through my work at the Guidance Center, I noticed the problem of women who are struggling with addiction losing their kids after their kids were born, which prompted the idea of what would it be like if we kept mother and baby together during addiction treatment.
That was Marca McCallie, founder and board chair of the nonprofit organization Sage Home in Flagstaff, Arizona. Sage Home is dedicated to fostering healthy family attachments through the challenges that come with substance abuse addictions. According to Marca, only 1% of substance abuse treatment facilities in the U.S. keep families together during recovery, even when research shows that keeping children with their parents during treatment is a vital factor for ensuring successful long-term treatment outcomes. In this episode, how community organizations like Sage Home are partnering with researchers at Northern Arizona University to address pressing health equity issues. I am Alexandra Samarron, your podcast host. From the Southwest Health Equity Research Collaborative and the Media Innovation Center at Northern Arizona University, this is Fairness First, a podcast dedicated to exploring issues of health equity in the Southwest, with a special focus on health equity in Northern Arizona. Here, we believe that good health starts in our homes, neighborhoods, schools, work, and other places that we find ourselves spending time in our communities. Most importantly, everyone deserves a fair opportunity to be as healthy as possible in their community, despite where they live. Hi, welcome back. I'm joined today by my co-host and dear work BFF, Carmenlita, who I will be referring to as Carm. Hey, Carm.
Hey, Alexandra. I'm so happy to be here and to be co-hosting with you today.
Yes, thank you. Please tell our listeners a little bit about yourself and the amazing work you do.
Well, I am a senior program coordinator here at SHRC, and one of my main roles is helping to promote community-engaged research, which is research that is co-led by community groups such as nonprofit organizations, as they could be city programs or indigenous nations, just to give you an example.
So I know that one of the ways that you do this work is through the CCPS program. Could you describe more of what that is?
Yeah, sure. So CCPS stands for Community Campus Partnership Support, and it's this incredible resource provided through SHRC that helps to nurture the development of new partnerships between a community partner and an NAU researcher.
Okay, so it sounds like the CCPS program is focused on relationship building, but I'm wondering, how exactly does it support this process?
In a nutshell, this program provides funding support up to $5,000 for new partners to meet in person several times over the course of 1 year, and that's to help them to get to know each other better. And we look at these meetings as opportunities for the community and NAU partners to discuss 1, mutual areas of interest, 2, community health needs, and 3, how they might be able to address specific areas of need through collaborative research.
That's such a cool resource, Carm.
I know, huh? I'm laughing because my res just came out.
Nice, let it out.
Okay, so because I have this opportunity to stand on my soapbox right now, or AKA my milk crate, because that's how we do on the res, I just quickly want to mention that since 2018, SHRC has funded 12 of these CCPS partnerships. And holy cow, these partnerships are doing such amazing and much needed community engaged work to help advance health equity here in our region. And we have folks who have used the CCPS program to inform and develop health interventions. Some have evaluated programs, while others have used their CCPS funds to do work that ultimately creates deeper community connections. It has helped them build coalitions and really to do work to inform policy as well.
Yes, that sounds great. I do know that later in this episode, you'll be guiding us further into dialogue about community campus partnerships. But what can we expect before we get to that?
Well, I do want to make sure that we provide our listeners with a more solid understanding of how SSHRC CCPS program helps to build community campus partnerships, like the one that Sage Home, who you mentioned earlier in your introduction, now has with NAU, but also why this step of partnership building is often overlooked and not really given enough weight in a traditional collaborative research process.
Okay, that sounds good, Carm. You know what I was thinking as you were saying that. All of that partnership talk sounds kind of academic-y. So, how do you think we could ground this conversation?
Yeah, that's a really good point. I was starting to think that myself, only because, in my role here as a community engaged researcher at SSHRC, I often have to go back and forth in between research speak and community speak, especially when I'm in Indigenous communities talking about research. And sometimes it's not easy, it's not cut and dry, because I have to be able to relate to the issue as someone who belongs to that community that has historically been disenfranchised, marginalized, and underserved.
Yes, I can relate to that as a Mexican immigrant. As you said, I also need to connect personally to whatever health equity work I decide to engage in. And in this case, we're having a conversation about partnerships between community and research, but we are also wanting to highlight how such partnerships have a direct impact in the community. For instance, the partnership that Sage Home has with NAU, it's focused on keeping children together with their parents during substance abuse recovery, which is an issue that many of us can relate to.
Totally. And that's why you're my work BFF. We get each other.
Oh, that's sweet.
No, but seriously, I think this is so important to hear. I want to just pause for a bit because we need to be able to recognize that, we can't completely detach ourselves and our role as people who are in academia from who we really are, at the end of the day, every day. I'm Navajo and you're Latina, and that's who we are, and we have specific lived experiences that go along with those identities. Yeah. And so I'm really personally interested in how you relate to the issues that Sage Home is trying to address.
Yeah, well, Carm, when it comes to substance abuse, that's a very personal experience that I have and that I'm very familiar growing up. My dad had a drug addiction issue, which resulted in my mom separating from him because that drug addiction created some violent dynamics that made things kind of unsafe for my mom and I to navigate. And so at that point, my mom decided to just separate from my dad so that her and I could have a safer life. And so, but I think that it is important to highlight that when we talk about substance abuse, especially in communities of color, we need to consider different historical events that have perpetuated trauma in a lot of communities of color that has resulted in substance abuse being a coping mechanism, which then contributes to the detriment of family and that family unit, which is what happened in my case. And often something else to add to that is that when it comes to substance abuse in communities of color, we are trying to make the point to not criminalize substance abuse, but actually see it as a health equity issue.
Exactly. I really appreciated you sharing that because I have a similar experience also with my father. So when I was a young girl, about kindergarten age, I specifically remember how common it was for my mom to take myself along with her and drive around. Sometimes she brought a friend with her to look for my dad because of, he was struggling with certain substance abuse addiction at that time. And I thought that was a common experience that was shared with my classmates and my friends. I thought everybody's mom had to do that, and everybody was looking for their dad on the weekend, which, was later I found not necessarily to be the case. So in relating our experiences on this topic, what I'm starting to notice here is that the main characters in this particular situation have been our fathers. Mm-hmm. And so that makes me think about, the situations in which the family member who is dealing with substance abuse addiction is the mother, because in both of our cultures, our mothers are the ones who hold it down. They hold down the family and make sure everything gets done and things are taken care of. So what then does treatment programs look like for mothers who are, going through this experience, and what kind of supports, adequate supports, do they have to get through that while also keeping their family together?
Yeah, I agree to a lot of what you just said. I think especially, it is exciting to see that there's community leaders that are trying to work together to end that cycle and really tend to the needs of mothers who are struggling with substance abuse and making sure that families are kept together.
So, Alexandra, bringing this back to research partnerships, you spoke with Dr. Nicolette Teufelschoen, who is a public health researcher and co-director at SSHRC. She also co-leads the Community Campus Partnership Support Program alongside me.
Yes, so in my conversation with Dr. Teufelschoen, she provided more information about the focus of CCPS and the components to think about when building partnerships between community leaders and researchers. So let's go to that conversation now.
So I serve as the co-director for the Community Engagement Core of SSHRC. And one of the things that we as folks who are focused on community campus partnerships have noted is it's oftentimes difficult for investigators and communities to figure out where their common interests are, how they might be able to work together. And so the purpose of the Community Campus Partnership Support Program is to provide some resources to both communities and university investigators to sort of nurture that relationship.
Yeah, I think that's awesome, because I think that's a step that in research tends to be skipped a lot of the times. And, building relationships and trust is such an essential element to research, and especially health equity research.
Let me address why this funding is needed. As you said, Alexandra, a lot of times when you look at ongoing collaborative research projects, they just start from the point of being partners, and then they move through how they may have worked together to come up with a plan, how they were going to collect data, how are they going to implement their plan. And very little attention is spent on how did that partnership get rolling. And there's a lot of different ways partnerships get started between universities and communities. If you're fortunate, you can slide in on someone else's partnership, and so you become an additional collaborator. But if your research or your, as a community agency staff member, if your interests are something different than has not been addressed before, then you're really in a position of starting something new.
Dr. Tuffushon also described how CCPS supports community and research partners when they're not located in the same place.
Maybe that here in Northern Arizona, a lot of times potential partners are actually geographically distant from each other. We've had partnerships from many of the northern counties in Arizona, so all the way over to Mojave County and Apache and Navajo County. So these funds can help support travel time, maybe even an overnight stay for either the university or the community partner, so that you have the essentially the support to get to know someone.
While listening to Dr. Tuffushon, I wondered about who takes the lead in the CCPS partnerships. She said that either the community partner or the research partner can take the lead in the collaboration. We can think about this in terms of any relationships that we engage in, right? Like with friends, coworkers, even lovers. And when I think of relationships, the first thing I think about is trust. Do I fully trust this particular individual to engage in health equity work? Do we share the same values? How will then decision-making look like when thinking about roles and who takes the lead? Let's see what Dr. Tuffushon had to say about trust.
But what we do know about effective health equity efforts and research is that most of them are grounded in really solid, trusted relationships. And we also know that it's oftentimes difficult for community and university partners to initiate their relationship in a trusted process that allows them the time to get to know each other. So we're really hoping this mechanism can offset the potential for distrust between community and university partners, and that we can really contribute to a strong foundation for community and university partners to build a effective idea and to be able to launch that idea within a year of their working together.
What would it be like if we kept mother and baby together during addiction treatment?
I want to remind our listeners that was Marca McCallie who posed this important question at the very beginning. It was this question which ultimately encouraged Marca to explore a possible research collaboration with NAU partners and doing that through the CCPS program. At this point, we want to wrap up this episode by tying everything we talked about so far into this conversation Carm had with Marca and her NAU partners, who gave us insight about their CCPS experience and reimagining ways to keep mother and baby together during substance abuse recovery programs. Take it away, Carm.
Okay, well, with that, let's jump right in. Marca McCallie founded Sage Home because she, as a licensed therapist, wanted to create a place where moms and babies could stay together while mom received addiction treatment and recovery support in a safe and trauma-informed community. She also wanted Sage Home to be a place where moms could connect to the community and be assisted in finding stable work and housing. When Marca previously worked for a community mental health center in Flagstaff, she noticed women struggling with addiction were losing their babies right after birth. The separation is stressful for both mom and baby, which can hamper the healing process and even reverse it dramatically. In Northern Arizona, there are no family-centered residential treatment centers, and it's something that's desperately needed in the region. Here's Marca.
Yeah, and that's a national trend. Less than 1% of treatment facilities in the country keep families together during treatment.
But in order to enhance services that Sage Home could provide to this unique population, Marca says she needed a more solid understanding of how the state child welfare agency operated, and that's where Rita Wright happened to step in.
My background is child welfare, so I've worked for Child Protective Services in different capacities for about 10 years. So my experience is working with parents who've lost custody of their children because of their addiction. And so Marca and I had aligned interests in how can we prevent women from losing their children due to addiction issues.
That was Rita. She is an assistant clinical professor in the social work department at NAU. It was Rita who first found out about the CCPS program and thought it would help get a conversation going between Sage Home's board of directors and NAU about possibly collaborating. Rita proposed the idea to NAU colleague Emery Eaves because she saw the value of what Emery, as a researcher, could contribute.
My name's Emery Eaves. I'm an assistant professor at NAU in the anthropology department. I'm a medical anthropologist. My research has mostly focused on chronic pain in the past and on lots of different substance use. And recently, I've been getting more and more interested in neonatal opioid withdrawal syndrome.
Very quickly, neonatal opioid withdrawal syndrome is a group of health problems that occurs when infants withdraw from opioids that they were exposed to in the womb before birth. Here's Rita and Emery describing the goals that they had going into the partnership with Sage Home.
We all want to produce better outcomes for this population. So it was really natural to sort of connect practice and research. And it's nice that we're all in Flagstaff in this community that so desperately needs this intervention. So my default is typically to think about like, well, how can we change policies to address this? But Marca was already, starting this program that's really a hands-on intervention in this community. So I think our interests just aligned really naturally, and it was supportive of Sage Home to have NAU on board. It was supportive of my interest to be able to partner with some practical intervention.
Like Rita said, we just kind of naturally have a similar motivation for why we were all wanting to be interested in this topic, which is ultimately some policy change and being able to show that something like this could work, that maybe child removal isn't the best option. So we were all kind of thinking about how could you look at something like what Mark is doing, really grounded in the community, but also make sure that it has the biggest policy impact in the future.
For Marca, Rita, and Emery, the benefits of partnership building through the CCPS program were substantial. Let's listen to them share what they experienced to be the highlights of their journey. A journey to combine practice and research to advance policy change.
That's a huge issue across the board between addiction treatment, the medical field, and the child welfare system. They're all so siloed, and they are all working with the same client, but towards different outcomes. And so it's really to the detriment of the family system. So it's really fortunate that we happen to have 3 people with expertise in those 3 different systems who can hopefully really affect change on a bigger scale.
Yeah, I think it's been massively helpful in the realm of Sage Home, the nonprofit. Because of the partnerships, because of the interdisciplinary health team, we qualified for the final round of a really big addiction grant that would fund basically our whole programming budget, called the Vitalist Grant. This team at NAU was a big reason why we were considered for that grant, because not only are we wanting to provide a service that we think is necessary, but we also want to make sure that we're researching that service to be very intentional about how we work with this population.
Emery pointed out that a huge part of their partnership building success was the result of getting to know each other outside of formal conference calls and meetings. The team used part of their CCPS funding for all of them to attend a behavioral health conference, allowing them to spend more casual time together, from travel to eating out together to attending sessions. Here's Rita chiming in on why this was so meaningful.
I think it also gave us time to sort of know what drives us to do the work that we do. And I think sometimes that gets missed when you're just all working on a grant proposal. You don't really get to understand the passion behind why everyone's doing the work. So I think that helped develop the relationship also.
And the team appreciated the conference opportunity because it helped them to meet others who were doing similar work across the state. And this expanded their resource network, as Marca alludes to here.
Well, when it comes to Sage Home, this project has, and partnerships have filled a lot of gaps that we had in our planning. We didn't have a lot of perspective on DCS. We didn't have a lot of perspective on the medical side. All the different connections that we've made have given us a chance to really make a simple idea a lot more deep and complex. Whereas, without this opportunity, it would have been, limited to a degree that maybe it could have done harm. So I was very thankful for the opportunity to get the other perspectives and the research and the participants from other viewpoints around the table.
Sage Home and NAU completed its 1 year of supported funding through the CCPS program in June 2019, a time frame that Emery says felt very short, which is a testament to the time investment needed for developing quality partnerships between community and university. Beyond CCPS, here's what the trio has been working on, according to Emery.
We submitted a grant to the Arizona Biomedical Research Commission last spring. It's still technically under consideration because they didn't have funding last year, so we haven't heard yet about that one. But it was a decent-sized grant that we're hoping if we got that, we would partner on the development of an app that would sort of support women and families in Marca's program. And the idea for the app came from observation of the burden of how many appointments people are having to go to. So living in a house could reduce some of that. And then the idea is to maybe sort of try to reduce a little bit more of the need for transportation and the need to take time while you're at work to go to an appointment or take time away from your child in the evening that you've had at daycare all day or something like that. So we've been working on little projects like that as we sort of try to work towards this bigger thing too.
And not only that, but Marca also plans to organize support groups in the next 6 months.
These moms really do need support right now, as we're gathering up the funding to open the doors. So we are starting a support group for parents that have had their kids removed. And we're pretty close to starting that. And we're ready to open up our doors. We have a few more things that need to get done, and hopefully that Vitalist grant that we're all a part of will be a big piece to opening the doors. It does seem like trust matters a lot in moving forward on a big partnership like this.
So I asked the partners, what advice do you have to share with others who might be interested in applying to the CCPS program?
Take the time to build their relationships. I think we're very eager to jump in and just do what we're passionate about right away. But we really need the foundation, and just having that year to build the relationships, to really think through with intention how we want to move forward has been really helpful.
Building in a conference or some kind of team building retreat or something like that right at the beginning is really helpful. I think maybe we still would have gotten as far as we did, but we're all so busy. We have so many things going on, so many irons in the fire that I think having that kind of weekend time to sit down together was a really big deal when we didn't all have, and we all have children, we all have lots and lots of things going on. So being able to have multiple moments over the course of the conference to be able to just be face to face and kind of share our interests in a not very formalized way. Not, we have 1 hour and we have to have this meeting and it's part of our whole grant. It was just a nice kind of informal way to build that team potential right at the beginning. I think I would recommend that.
So we'll let Rita and Marca wrap up. In their own words, how CCPS has strengthened their collaborative work.
It really helped bridge connections within the university and within the community and even across the state, because we're dealing with so many different systems. So us meeting kind of started our own network. Like we were the nucleus of a bigger network. Am I taking too much credit?
No, definitely nucleus. Yes, exactly. It's an exciting field in a sense that we really are breaking through and doing some new things that could potentially change how we operate. And yeah, it's exciting.
Carm, thank you so much for having this meaningful conversation and for co-hosting this episode.
Yeah, no problem.
Before we go, if researchers or community leaders want to learn more about the CCPS program or want to apply, where can they do this?
The easiest way to get more information about applying for the program is to visit the SHERC website, which is located at nau.edu/SHERC, SHERC.
Spectacular. Thank you, Carm. Thank you so much for guiding us through this conversation today.
Alexandra, it was my pleasure. Thank you so much for giving me this opportunity, and I'm looking forward to having more conversations with you about this. And to our listeners, if you have any questions for me regarding CCPS, you can find my contact information in the show notes for this episode.
Bye. You've been listening to Fairness First, dedicated to health equity in the Southwest, a podcast to explore what are the social determinants of health and what can we do to build healthier, fair, and inclusive communities in the Southwest. Brought to you by the Southwest Health Equity Research Collaborative Initiative and the Media Innovation Center at Northern Arizona University. We want to hear from you. Visit us on Facebook at NAUCHER, Instagram at NAU.CHER, follow us on Twitter at CHER Arizona, or send us an email at SHERC@nau.edu. Tell us what you like, what can we do better, or tell us what topics you want to listen to in our podcast. The Southwest Health Equity Research Collaborative, Community Engagement Corps, and the Media Innovation Center at NAU produced this episode. It was edited by Aldrich Mines, music from filmmusic.io, song title Fearless First by Kevin MacLeod, licensed by creativecommons.org. Special thanks to NIMHC grant number U54MD012388 and Northern Arizona University's Southwest Health Equity Research Collaborative for funding this podcast. Thanks to our Fairness First team, Carmenlita Sheaf, Dulce Jimenez, and Kelly McHugh from the Community Engagement Corps, and Brian Rackham, Director of the NAU Media Innovation Center. Thanks for making this podcast possible. I'm Alexandra Samarron. Thanks for listening.